Bună seara, din nou, sunt doctorul Adrian Alecu, medic primar de medicină internă, lector de homeopatie și în acest moment sunt din nou împreună cu dumneavoastră cu ocazia primului workshop internațional de medicină tradițională chineză, medicină tradițională thailandeză, combinate cu medicina tradițională și medicina modernă occidentală, care are loc la UMF Târgu Mureș. În această zi am calitatea de gazdă și urmează să vi prezint pe invitații noștri, lectorii din China, care ne-au prezentat la acest workshop elemente de medicină tradițională chineză și voi trece în limba engleză rugându-i pe fiecare să se prezinte, după care vom discuta particularități ale medicinei tradiționale din China. Hello, my dear guests.
Hello.
I will invite you one after each other to present yourself and to tell us a few words about yourselves and about your experience and activities that you have. The first one, Dr.
Okay.
Xiao.
Okay, I introduce myself. Okay, I'm Dr. Xiao. I'm from Shantou University Medical College from China, and I am the director of Traditional Chinese Medicine Department, and my title is Chief Physician of Traditional Chinese Medicine, and my major is Traditional Chinese Medicine. That means, my family is a TCM family. My grandfather and my mother was engaged in traditional Chinese medicine, so it's my honor to come to this university to attend the workshop. I think this workshop is very, very great. Okay.
Thank you, and thank you for coming. And our colleague?
Okay. I'm Dr. Chen from Shantou, China, and I also the college of Dr. Xiao. And I'm from the Shantou University First Affiliated College Hospital, and my major is in TCM acupuncture, and I am also a TCM acupuncture doctor. It's pleasure for me to come here and gave the local people a workshop about what traditional Chinese medicine techniques can bring us in the pain management. And indeed, both the lecture between Dr. Xiao and I have left a great press on these 2 days. And I hope the local students or the professor can learn something from what we bring. And thank you.
Thank you too. Now I will like to ask you some questions in order to make our viewers accustomed and aware about how medicine is going in China, because as I understood from you, the structure of medical services and of medical studying is different than in Europe. I understood that traditional Chinese medicine is studied also in university, in faculties. Please tell us about studying. How, for example, if high school student is finishing the high school, what will be his way in order to graduate traditional medicine or standard conventional medicine? Please.
First,
give us some.
I can tell you something about traditional Chinese medicine education in China. That means when you finished your senior middle school and you in China, there probably every province has one traditional Chinese medicine university, and when you pass the exam, finish the senior middle school, and you enter the traditional Chinese medicine university, and you stay in the university for first of all 5 years to get a bachelor degree of traditional Chinese medicine, just like acupuncture, moxibustion, internal medicine, and so on. And if you want to study further, you study extra 3 years to get a master degree of traditional Chinese medicine. And for example, just like me, I studied extra 3 years. That means, I was in the university for totally 11 years to get a PhD degree. So, in China, just like to be a TCM doctor, that means you must study in the university for more years, that get at least a master degree or PhD degree. I think this is traditional Chinese medicine education in China. Then when you finish get the master degree or PhD degree, then you can start your job in the hospital or open the clinic, and so on.
Mm-hmm. And what if you want to become a Western medicine physician?
Oh, okay. Till today, if you go to the traditional Chinese medicine university and you studied, I think this is an integration of traditional Chinese medicine and Western medicine. That means if you are a traditional Chinese medicine doctor, when you get a degree of PhD degree or master degree, that means you know both. That means you know not only traditional Chinese medicine, but also Western medicine. And if you start a job in the hospital, that depends on different doctors. Maybe some doctors, they prescribe both. That means TCM and Western medicine pills and injections. But some traditional Chinese medicine doctors, they are, what should I say, just like a traditional Chinese medicine doctors. That means this kind of TCM doctors only prescribe Chinese herbs and using acupuncture and moxibustion, doesn't use anything about Western medicine. But that depends. This is yeah.
And what about medical specialties like cardiology and so on? Are they available for you as traditional Chinese medical graduates, or there are separate faculties in order to become a specialist in a medical field?
Okay.
Cardiologist, gastroenterologist, or surgeon or something.
Okay. That in China, there because China is so huge, and many cities, they have lots of different kinds of hospitals. For example, if you stand a chance to go to a TCM hospital, this kind of hospital is called the traditional Chinese medicine hospital. Maybe you use their different parts of traditional Chinese medicine, just like for some department, is for the case, for the women, for the other kind of different kinds of diseases. But if you stand a chance to go to, for example, just like a Western medicine hospitals, and every Western medicine hospital must has a traditional Chinese medicine department. If you stand chance to go to this kind of department of traditional Western medicine hospital, you must. That means you must treat all kinds of different diseases of the patient.
Mm-hmm. So every hospital in China has Western medicine and traditional. Every Western medicine hospital has also a department of traditional Chinese medicine.
That means every hospital has traditional Chinese medicine department
in China.
In China, yeah.
Nice. So, and the different physicians, the different doctors can collaborate. They can work together on the same patient.
Yeah.
They send to each other, they listen to each other.
Yeah, this is a cooperation between Western medicine doctor and Chinese medicine doctor. That means, for example, in my hospital, and if the Western medicine doctor encounter a problem that he cannot solve, totally, and the Western medicine doctor can recommend the patient to go to my clinic to seek, traditional Chinese medicine medication. That means this is helpful for the patient to recover. And if I met some diseases that I think the traditional Chinese medicine maybe the effect is not good. For example, just like an operation because of tumor or some surgery, I will recommend the patient to go to the professional doctors of the hospital, maybe the Western medicine doctors. Okay.
Okay, I understand. So actually, you make teams. No,
Yeah.
you advise with each other, the doctors.
But sometimes.
Sometimes.
But sometimes in the other occasions, for some patient, especially the patient has, what should I say, just like a serious disease or a strange disease, the hospital will get us, including traditional Chinese medicine doctor and a Western medicine doctor to see the patient totally. Mm-hmm. That means, Western medicine doctor gives a recommendation, and I, as a traditional Chinese medicine doctor, I give some advices to the patient that we combine the two medications together to help the patient to recover.
Very nice. This is called integrative medicine.
When
combining modern with traditional.
Combining in some occasions.
Practically is a more wide action of the medicine because you can accept more techniques for the patient. With more chances to recover.
Yeah.
In my opinions, some disease can be better treated in TCM method. So in my hospital, some other department will send the diagnosis requirement to our apartment and request us to cooperate in diagnosis some kinds of patient and give the better way to treat the patient like this. For example, pain syndrome or neurology syndrome. And as a acupuncture doctor, I think this is a better way to help these patients.
This is very nice. Please tell us more in order to understand how a traditional medical doctor can diagnose a patient differently than a Western medicine doctor. Which are the techniques on which you diagnose a patient as an acupuncture doctor?
Mainly, we diagnose the patient by the Meridian system. That's the branch of the TCM system. And we find out where the disaster lie in which meridian, and then we use our meridian views to solve this problem.
Please tell us more about meridians and about elements and how traditional Chinese medicine sees the patient in a whole, as a whole.
Yeah, because the meridian contact the whole body, and we know when some area of the meridian is blocked, we can use our method like acupuncture or massage to unblock this meridian and occur and our goal to treat this disease.
What are the meridians actually?
Actually, the meridian is hard to explain. And
it's a channel or
It's meridians as a branches in TCM theory as a branches of qi and blood. We traditional Chinese medicine theory think that all kinds of disease, the reasons of the disease means some stasis of the qi and the blood. What should we do? For example, just like Chinese herbs, massage, acupuncture, moxibustion, that means to make the construction of the qi and the blood to regulate normally. Yeah.
Qi, I understood that qi is an energy, the vital energy which makes everything to live in the nature.
Yeah.
And it is present also in the universe, or only in the body?
In the universe.
In the universe. Is it true that the acupuncture needle is a connection between the body and the meridian and the qi inside and the qi outside? Is it like an antenna somehow, or this is only a legend? People in Europe are used to say that Chinese acupuncture means when putting the needle in a acupuncture point, it will make a connection between the universe and the body. Is this true, or this is only a story? It's too complicated.
A little bit.
What does according to your knowledge, what does happen when the needle is inside the body? What action will it have?
In my view, when you insert a needle in the points of the meridian, we open the gate, and we can let the petal out or let others in. And this is, when you open the gate, we force the way to trip the digit. And the meridian is stimulated, and this force, and we enforce the qi in the meridian. And then in this way, we treat the digit.
So it's not a connection between the universe and the body.
Just like
too far to say that.
Just like you said, in TCM theory, Chinese philosophy, we have the concept of qi, that we believe in, that qi exists in the atmosphere and inside everyone's body. And when we as acupuncture use acupuncture, that means you insert the acupoint of the branches of the body. That means, just like Dr. Chen said, just like open a gate. That means, we think that some disease, the reasons of the disease is, we have a concept is called 6 evils. Some evils inside the body, for example, just like the cold, the wind, the heat, and so on. And when we inserting a needle, that means open the gate and to remove the evils outside. That another thing is to regulate the qi and the blood of the branches, just like I said.
This is very interesting. It's a different view from the Western medicine, but thousands of years of experience show that this is working, and it's working quite effective.
Yeah,
right.
Traditional Chinese medicine has already existed in China for more than thousands of years. So, in a word, traditional Chinese medicine is an experienced medicine. For example, just like in Western medicine, you have diagnosis methods, 4 diagnosis methods. But in TCM theory, we have 4 diagnosis methods, but it's a little bit different. For example, just like inspection of a patient's tongue is necessary for the doctors. And feeling the pulse is also very necessary for every patient. So just like you mentioned in the last question that when a patient go to the hospital, what should you do to the diagnosis to the patient? For example, we as a traditional Chinese medicine doctor, we have our own diagnosis methods for the patient, just like I said, inspect the patient's tongue and inspect the figure of the patient and feel the pulse of the patient, and the doctor will tell the diseases of the patient. If I think it is very I have a need that for the patient to get a diagnosis of the Western medicine, maybe I can prescribe a test, for example, just like X-ray, CT, MRI, and anything to the patient. And if I think the patient should go to see a professionals, so I will recommend the patient to go to the profession to get a better treatment for the patient.
Interesting. What can you see on the patient's tongue? How can you diagnose when a patient opens the mouth and show you the tongue?
Yeah.
Tell us some words about what can you see on the tongue. In the Western medicine, sometimes we learn how to look at the tongue, but we learn very few things.
Yeah, just like I said, as a Western medicine doctor, I think he seldom inspect a patient's tongue. But as a traditional Chinese medicine doctor, inspection of the tongue is necessary. That means, just like I said, the traditional Chinese medicine is an experienced medicine. That means when you inspect more and more patient's tongue, and you can find lots of differences between the different patients. And for example, just like a swollen tongue and thick coating or thin coating and red tongue or pale tongue, in my opinion, is quite different. So I can tell from the tongue of the patient, I can tell the patient maybe you have something disorder, and I will prescribe Chinese herbs or using acupuncture or this kind of traditional Chinese medicine medications for the patient to cure the disorder of the body.
So you inspect the form of the tongue, the consistency of the tongue,
anything.
the coating, the color,
yes, anything,
the margins,
all
the tonus,
anything
about the tongue.
Yeah, anything.
It's like a mirror of the inside somehow.
This is, traditional Chinese medicine has existing for thousands of years, and TCM theory is focused on the organs' functions, not the focus on the anatomy. So traditional Chinese medicine theory must do something. The things is that you must tell the patient's diseases, not using X-ray. We don't have X-ray or blood test. That you must tell the patient's disease by inspect some disorders in your opinion, and feel the pulse that tells the patient's diseases, different diseases of different organs. You must so a TCM doctor must be an experienced doctor, can find any things.
So you have a map on the tongue, right?
Yeah.
Every organ, most important organs have their own place on the tongue.
Yeah.
And in this way you can find information about the state of these organs.
Yeah, just like you said, for example, if a patient go to see my clinic and I inspect the patient's tongue, and if you find something disorder, for example, just like the bruise of the tongue, maybe in practice we found that lots of patients, for example, just like tumors and some, we think this kind of patients maybe have some disorder of the static blood disorders. So maybe we recommend the patient to do some test to find something ahead of some symptoms.
Confirm or infirm.
And the modern TCM doctor not only diagnoses by the tongue, the pulse, also the color, face, and the other diagnosis evidence like CT, MRI, and the function of your organs from the blood tests, and combine all the diagnose evidence to diagnose the disease.
Please tell us about how do you measure the pulse and what information do you find by diagnosing the pulse as a traditional Chinese medical practitioner?
Different parts of the pulse refer to different organs of our body, and only when you pulse thousands of patients, you can get the difference between the patients. And we have the basic pulse phenomenon, and according by this, we can differ the different patient, different disorder.
So the 3 fingers which you use to measure the pulse on the right, on the left, on the right,
both sides.
Yeah.
Both sides, yes. Each finger will take
Different
information.
Different organs of disorders. Yeah. So feeling the pulse is a very unique diagnosis for traditional Chinese medicine. That I know Western medicine doctors maybe feel the pulse of the patient, but the contents are quite different. We can tell from a patient's pulse that we can tell some disorders of the patient. Just like you mentioned, every patient we must feel the pulse of the two sides. That means a different finger you feel different disorders of the organs. Just like the heart, the lungs, the kidneys, and this kind of organ disorders we can tell from the pulse. Yeah, it is mysterious, I think.
It is maybe mysterious, maybe fascinating, more fascinating than mysterious, because it's a science actually.
Yeah.
And as scientists, we must admit that we cannot know everything. And even if we know very much, always will be more to know and more to find out. And if somebody else, another scientist, knows something that we don't know, we must admit, yes, maybe these things are real.
Yeah.
Because also they are verified by thousands of years.
Traditional Chinese medicine, just like I said, TCM is an experienced medicine, and just feeling the pulse and the inspection of anything, that I think the TCM doctors must do lots of practice in the clinics. For example, just like me, 1 year I have at least 10,000 patients. So every day you have lots of patients. That means you do a lot of practice in your clinic every day from morning till night. That means if you inspect too many patients and you feel too many different kinds of patients, you can have your experience that you can tell something to the patient that I think you have some disorders of some organs, and I can recommend the patient you can do something for your health.
So 10,000 patients in a year.
Yeah.
This is how many per day?
Because China, has a large population, and in some biggest hospitals, the doctors, I think, are very, very busy the whole day. For example, in my clinic, from 8 o'clock to 12 o'clock, the total 4 hours, you cannot stand a chance to go to the toilet or drink water one by one. So every day, this is our daily work every day.
So this is the public hospital or it's a private hospital? Do you have private hospitals?
No, not private hospital. We work in the
state hospital.
Yes, state hospital. Yeah. Especially in China, the state hospital, this kind of hospitals has a large that means a large amount of the patients. Every day the patient cure every department, because in China this is a phenomenon that patients they live in state hospital. They think the doctors, and indeed the doctors in the state hospital, they are maybe the graduate from the university, get a higher degree, just like a master degree or PhD degree, and they are professionals, I think, yeah.
So they are more appreciated.
Yeah. So if you stand chance to go to the state hospital of China, that means you have lots of practice. You can do a lot of things every day, and maybe 10 years later, you have lots of experience and you can be a profession.
10 years of 10,000 patients per year, this means
Yeah.
100,000 patients.
Practice make perfect, and in the hospital, in the big hospital, it helped the young doctor to grow into the experienced doctor.
Very nice. I understood that every patient comes first to a diagnosis process, and after that he will make therapies. How many therapy sessions are necessary after the initial diagnosis? And which one is the most frequent used therapy? Acupuncture, moxibustion, or massage or herbs? Which one do you, for example, you?
In my view, in my hospital, acupuncture used the most because it's convenient, and we just bring the needle and sterilise things to treat the patient. But in fact, the massage therapy is more acceptable by patient, and both we will apply on the patient, but mostly the acupuncture.
How many sessions are necessary after the patient comes for the first time? How many times do he have to come for treatment? For example, if I come with a low back pain, you diagnose me and you make acupuncture. One session is enough, or do I have to come?
It depends on the situation of the patient. Maybe some patient accept the 3 times treatment is okay, but sometimes they have to treat the longer session of the treatment. It depends on the situation
Of the patient.
Yeah.
Which is the maximum of sessions?
Maximum.
10, 20? How many times? How many times it's the maximum?
The most in my hospital maybe 20. 20 times.
And how often? How many days have to pass between each treatment?
Some for the acute situation, the patient had to come day by day.
In acute cases or in chronic?
Yeah, in acute
cases.
And in the chronic cases, some patient will come week by week, once a week. Yeah, it depends.
This is why I'm asking, because I know it depends. Okay, so time is passing. I will put you only 1 or 2 questions more. Please explain me and our viewers how after graduating, I understood you graduate TCM University.
Yeah.
After that, it's a master degree.
Yeah.
After that, it's a PhD,
Yeah.
optional.
Yeah.
So it's 11 years.
Yeah.
After that, do you have to be member in a medical association or something? Do you need continuous medical education or to participate occasionally into education programs? I ask you because, for example, here in Europe and actually everywhere in the world, Western medicine doctors have to gain points or credits each year to participate in a certain number of hours of continuous education.
Yeah.
Do you have such programs?
Yeah, because the world is changing and every year have the new techniques or new theories outcome. And with TCM doctor also have to study all the time to follow the world's changes.
You are obliged to study or you want to study
Both.
or both?
Both, yeah.
Yeah.
Both.
So you have to participate in obligatory.
Participate some program to enhance your skills, and I think including Western medicine doctors and traditional Chinese medicine doctors, I think the career of the doctors that means you stay the whole life. That means not only students wants to study. If you are an old man to be a doctors, I think you must study the
All
whole
your
life.
life.
Yeah.
All your life you have to study. Yes, this is true. And do you have conferences or congresses of traditional Chinese medicine? Conference, national meetings, for example, where all the
Conference,
national
national some conference.
Yes, you
yes,
organize.
indeed. All kinds of different ages of traditional Chinese medicine doctors. They must attend some meetings or conference to enhance the skills. For example, just like me, I every month I must have attending some conference of the national conference to other cities just like Beijing, Shanghai, Guangzhou. That means a different conference can give you different view of to be a doctor. That means you can learn some new skills, or you can learn some new concept, and you learn some practice, some experience from the other persons. I think it does work. That means when you come back to your clinic and you can use new techniques or use a new concept for your patient to help them.
Yes, and one more question. Traditional Western medicine doctor in China can become a traditional medical doctor?
Yeah, if they want to do this thing, that means in China we have some programs for the Western medicine doctors. If they want to learn something or they want to grasp something about traditional Chinese medicine, we have some program for and some conference for this kind of Western medicine doctors to join in and learn something, and this can help the Western medicine doctors to use it or to think it in a traditional Chinese medicine view, and maybe some problems they can solve. And if they encounter maybe a problem that he cannot solve, he can ask some advices of ours that we can help the Western medicine doctor to enhance his, the practice of the thinking of the traditional Chinese medicine.
So there is a school or a learning program for the Western medical doctors?
Always learning program, and some universities of traditional Chinese medicine and apply this kind of program to the Western medicine doctors. If you are interested in traditional Chinese medicine and if you want to learn something about TCM, you can attend in this program and to enhance.
What is the duration of this program?
That depends. That depends. Some program may be a short-term, and some program may be 1 or 2 years to study. That means this kind of Western medicine doctors can learn much more, and in the clinic, in the department, he can use both two medications. I
Just
think it's
like you.
good.
Yes.
Yeah.
Okay, I understood. We came to the end of our show today. I want to thank both of you very much for coming in this show, for coming in our workshop in the university, and for visiting Romania. And I hope that you enjoyed your stay and your trip.
Thank you.
Okay, thank you.
Thank you.
Romania.